Hi, my name is Claire. I'm a nurse practitioner from NP for NPs, Unsure to Unstoppable. And today I'm going to talk a little bit about creating breathing room as a nurse practitioner, creating more control and flexibility and freedom in your role. I remember as a brand new nurse practitioner, um, an expectation that I had that I would be having a lot more freedom and control as a nurse practitioner compared to being an RN. I was excited about this and I was looking forward to feeling just more free in all ways. Um, Unfortunately, over the months of working as a nurse practitioner, I started to feel the opposite. I felt more constricted and pressed with time than I did as a floor nurse. And this was disappointing to me. I was missing my bedside nursing experience, where when a patient was in groups or napping, I was able to document, catch up on documentation or other things I needed to get done. I just felt like I had more um, autonomy in some senses as a floor nurse, and that really frustrated and confused me as a nurse practitioner because I was expecting to have more freedom, not less. For me, in particular, as a nurse practitioner, when I was brand new, I just felt like I had little control over my schedule, which made me feel um, stressed at times. Where patients would be just plopped into my schedule back to back all day with limited breaks or times to document, and that made me feel really enclosed. And over the years, I got a better sense of what was important to me in terms of ways to increase my feeling of freedom and flexibility and control. And for me, I learned that having control over my schedule was important to me. It helped me feel more autonomous and free, that I would be able to put patients in my own schedule and have sole control over that was very helpful. Also, having protected documentation time was something that I learned helped me feel freer also, so that in subsequent jobs I went to, I made sure during interviews to ask about the ability to control my own schedule and to have time for documentation because I knew that those things would help me feel more um, more free and able to provide my best care and feel as free and open as possible. Now, my suggestion for you is to keep in mind and gain awareness of what you do and don't like about your work as an RN and as a nurse practitioner at your first job. Pay attention to things that make you feel more constricted and stressed, and pay attention to things that you really like because those likes and dislikes, those preferences will help you be intentional with your job search going forward in subsequent jobs or even your same job if you're wanting to make adjustments. As nurse practitioners, we should be feeling um, more free and hopefully less stressed and more in control of our careers than we did as nurses. Although nurses should also practice the same awareness of preferences so that we move forward, getting more of what we want. I think that when we feel constrained and constricted, that leads to burnout quicker and leads us to leaving jobs in the fields faster. And so, my recommendation is to pay attention to what you like and what you don't like to create more freedom and flexibility and control over aspects of your job that you want to shift. I hope these tips helped, and if you want more resources and tips about transitioning into practice in a smooth way and navigating your career successfully, you can check out my website np4nps.com and join our mailing list. Thanks so much, and I will see you next time.